Hi, my name is Sheena MacDonald and I am the care at home nurse within Kilbryde Hospice.
And my name is Louise Gray and I am the care at home complementary therapist.
And together we are the care at home team. So on a daily basis, my role is to go out and meet with patients or families who are unable to come into the hospice to attend the day services unit for a multitude of reasons, but perhaps because they're too unwell to actually be able to travel in for that. So I would go out and do nurse assessment and have a chat with the people about what they're looking for from the hospice, what their goals would be, what they'd like to achieve, whether it be psychosocial care or whether it be looking at some complementary therapy in order to alleviate some of the symptoms that they are experiencing. And also part of that is looking at the carers as well within the home setting, many of who are unable to actually leave the setting and are full-time caring, and so consequently may need some help with psychosocial issues or with anxiety or worry themselves. And once I've had a look at that, I'll come back and I'll discuss it with Louise, and we will then look at providing some therapies for them. And Louise, you...
So what we would look to do is provide a block of therapies for the patient, and if necessary the carer also in the home, and that just takes away any stress for the carer, especially of having to leave their loved one to come and receive therapies. It also means that once I leave they can just relax in their own home afterwards. We're trying to help really with the stress and anxiety that surrounds the illness, both for the patient and the carer. Sometimes it can actually be harder for the carer. They feel they have no control over what's happening to their loved one, and that can be very stressful for them. So we offer a range of therapies. We can deliver some aromatherapy, some gentle massage, reflexology, Indian head massage, Reiki, or we can even take the patient or carer through a nice relaxation session, visualisation, just to help them switch off from their surroundings for a while. We also make use of some soothing, gentle music, and we use scents of the oils if it's appropriate. Just everything that we have available to try and help the patient and carer relax as much as possible. And the hope is that these therapies will help with problems like obviously stress and anxiety, but all the other things that are associated with that, such as insomnia, often nausea, headaches. And what we find, although we're not there to strictly address pain, once the person is more relaxed, we find the pain often lessens also. So there's actually a number of things we can do to help people.
And from my point of view, as all this is going on with Louise, I'm obviously there to offer any support that is required. They know that I'm available at the end of the phone to be able to have a chat to if there's something that's bothering them. During that assessment I would have seen whether they need to be referred to any third parties, perhaps some district nurse, a cover, some social work help, all the things that they're not always aware of that they're able to actually have. And then usually I will go and see them after about the third therapy just to see how things are going and if things are falling into place, and then see them again at the end of the therapy. One of the other aspects of the role that I have is looking at befrienders. I have a group of volunteers who have kindly given their time to give 1 to 2 hours to befriend somebody who is perhaps socially isolated, or they may have a carer but the carer is unable to go out as well due to the role that they have now moved into. So sometimes people were specifically referred just for befriending, and sometimes I will encourage them to move on to that once we finish seeing them for their therapies, because a lot of them remain isolated, and the fact that we've been going in has been enough just to relieve that for them. So again, and we'll go out and assess their needs and then I'll try and match them with a befriender who I think will be suitable and who will be able to give them the support that they need. And I will take that befriender out for an introduction, and then we take it from there and they go on their own. But obviously I'm there for support and follow up for the befrienders as well. And that usually lasts for about a period of 6 months. And that's a really good service, and it's proving to be really successful with a lot of our patients. So that's really what we're all about.
That's it.
And it's a wonderful job, and we enjoy
Very
our work very
rewarding job.
much. Very rewarding, yes. So thank you.